All right, so welcome everyone. Good afternoon. Thank you so much for joining us for our first EHE office hours in our series of 3 that we'll be doing. Today, we are going to be focusing on EHE innovations, and we're really excited to give you all an exclusive sneak peek of our new EHE innovations microsite that we'll be launching shortly. Just a couple of housekeeping items. If you all could make sure that you're on mute. We are monitoring the chat, so if any questions come up, please feel free to utilize the chat. We will be hearing from some presenters this afternoon as well, so we'll have some time for questions after their presentation. And this session is being recorded, and we'll be sharing the slides and recording afterwards. So my apologies. My name is Allison Heinrich. I'm a manager on the Health Systems Integration team at NASTAD. And just a quick disclaimer that we are funded by HRSA as part of a cooperative agreement, but this session does not necessarily reflect their views. So this is a brief recap of our agenda for this afternoon. So I'm going to quickly talk about NASTAD and the SCIP in case any of you might be a little unfamiliar with us. We will then be doing an innovations microsite walkthrough. Well, I will take you through our new microsite and kind of show you what it's going to look like and how to navigate the site and answer any questions you might have. We are then going to hear from our esteemed colleagues with Columbus Public Health in Ohio, who will be sharing their innovative activity that will be featured on the microsite. And we'll have time for questions after their presentation. We are then going to have a good amount of time for some small group discussion. We'll be going into breakout rooms where you all will get to connect with one another, have some peer-to-peer sharing and learning, and discuss what innovation means to you, what innovative activities you all are doing, discuss your successes and challenges, and really just have some time to learn from one another. And then we're going to come back after that to this large group and do a report out so we can hear from each group. And then we will wrap up and share some next steps as well as our evaluation. So for those of you who might not be familiar with NASTAD, we are a nonpartisan nonprofit association that represents public health officials who administer HIV and hepatitis programs in the United States. We serve governmental public health agencies across states, territories, and local jurisdictions. And we do this work by strengthening governmental public health through advocacy, capacity building, and social justice. And then I am on the Systems Coordination Provision team, or the SCIP, as you might hear it. You know, it's public health. We do love our acronyms, but we provide TA around really looking at the integration of healthcare delivery services. So not just with EHE, but also looking at our ADAP partners, our Ryan White partners, Medicaid, private insurance, and really looking at how we can all work together to really advance the goals of EHE. We support EHE-based jurisdictions through various methods, including leadership development opportunities, such as our EHE mentorship program. We have various learning collaboratives, including our housing learning collaborative. We have communities of practice, disseminate and publish resources, and we like to facilitate peer-to-peer learning here at NASTAD. Some of our expertise that we have around technical assistance includes data sharing, integration, and data to action, data to care, helping jurisdictions delineate between Ryan White parts and EHE administrative design. So really looking at your program policies and procedures. We can help with procurement, subrecipient monitoring, and program evaluation, the development of innovative programming for priority populations, and we also provide a significant amount of TA around stakeholder and systems level engagement. And this is the friendly faces of our EHE SCIP team. So definitely feel free to reach out to any one of us if you have any questions or if there's any technical assistance that you may need from us. So before we get started, we are going to do a quick Menti poll. So if you all have used Menti before, you can either use your computer or your phone, but could everyone go to menti.com? And then our code is 33112770. And I'm going to switch screens really quick. But when I pull that back up, the code should show. Right, so if you have logged on, I would love to hear what word comes to mind when you hear innovation. What do you think of? Inspiration, okay, new ideas. Trailblazer, oh, I love that. Unique, creative, yes. Better, absolutely. See, we got 10 responses. Oh, we're getting more, okay. Progress. Y'all, I'm loving these words. These are amazing. I love the optimism. I love the positivity. This is incredible. Looks like new is one of our more popular ones. Outside the box. Yes. I don't know if you all have heard. I remember when I first started at NASTAD, we were told to be disruptively innovative. And outside the box is what I thought of. So would anyone like to come off of mute and share why they chose their word? We'd love to hear from one or two folks.
Um, I put progress. I think with innovation, um, it it should be also about us moving forward and not just how we're addressing right now, but trying to look at how things are going to grow and evolve to so that if we create an innovative program that it's going to be able to kind of move with time and not be outdated as soon as we get it, so that it's progressing with everything. And
Yes, absolutely. I completely agree. Um, Really, EHE has been this great opportunity to do something new, to do something we haven't done before. Because there are certainly, programs and activities that we have done for many years that are successful, but it doesn't work for everyone, right? Otherwise, we would have been with HIV by now. Would anyone else like to share? Oh, here we go. Modernization. Yes. Oh, different. I like that. All right, well, I'm gonna go ahead and stop this. Get back to our screen. So next on our agenda is actually our innovations microsite walkthrough. All right, so this is this is more of a sneak preview of our innovations microsite that we will be launching very shortly. We were really hoping to have it launched, but with USCHA last week, and I don't know about y'all, there's a lot of sickness going around, so we've had a lot of staff in and out recovering from illness. So we were a little behind, but that's okay. We're still going to show it to y'all, and that way you all will know what to expect. But when it is ready for launch, we will be sending out a memo. But that way, when you do have access to it, you'll know exactly what it looks like, what to look for, how to navigate the site, and all of that good stuff. So this is the beginning of our site. So there's really two options to navigate. You can just continue to scroll and just go all the way down. These are all of our tabs. Or if there's a certain section you'd rather just jump to, like if you want to go to the map, here, you can just click Innovations Map, and it'll take us right to the map. But for the sake of today, I'm just going to start from the top and kind of work my way to the bottom. So really, this microsite is a repository of all the EHE innovative activities that have been implemented in phase 1 of EHE. We really want this to be a tool that you all can look at and use and gain inspiration from and see what your peers are doing. And perhaps, there's a program here that a jurisdiction is doing that you're like, hey, this might work for my jurisdiction. And you can gather more information and see, if that's feasible for you to do or if you need to make any adjustments. But we really wanted this to be a celebration of all the hard work you all have done. Because we know there's been a lot of challenges, especially in the beginning of EHE. So really just to share your successes and share your wins, because you all have done such amazing work. This microsite is supported by HRSA, as we have been awarded a new cooperative agreement. So as we continue to scroll, we have a reminder of our 4 pillars that EHE is addressing. So diagnose, treat, prevent, and respond. And we're going to continue to scroll, and here we write about our approach and how we got this information. So really, we collected this information through various ways. So the first is through surveys. Some of you might have seen the survey or have already completed it, but we have been doing outreach to all the EHE Phase 1 jurisdictions with a survey to gather more information about your innovation. So that's one method that we've used. Others have been working with you all at intensive technical assistance sessions and site visits, learning more about your programs and activities, and the successes you've had, and making note of that to circle back and get some more information, so that we can kind of complete that survey on your behalf. And then the other way we've gathered this information, we hold regular virtual meetings with key stakeholders across all the local jurisdictions. So really this information has been gathered from various sources. And when we do launch this site, it's gonna start with 10 jurisdictions being featured, but we will continue to update this site as we continue to receive the information from you all about your innovative activities. And as we continue to scroll here, we talk about our format. So each innovation that is featured, we have it categorized, and we have 4 categories: diagnosis, linkage, retention, and viral suppression. And we chose to kind of categorize them these ways, so that way it's a little more user-friendly. If you're looking specifically for innovative activities around linkage to care, you can just look for linkage and it'll show all of those. So to really help kind of tailor your search. And as we continue to scroll, now we come to our interactive map. So as you can see, all of the EHE states are highlighted in blue, and all of these blue dots are the EHE local jurisdictions. So we haven't been able to put in the innovations quite yet, but let's say, for example, we're going to look at Missouri. So I would click on Missouri. If this was completed, it would say the name of their program, what pillar this program addresses, the type of intervention. So again, is it a linkage intervention, viral suppression? Those 4 categories, we have them listed under. And then we also have our target population, or our priority population, that is served through this activity. We will have a short 1-paragraph blurb that kind of summarizes the program, just a little quick snapshot. But we'll also have a link to a PDF that's much more detailed. This will have much more information, including the staffing that is needed for this program, the budget, key metrics, any key considerations that were considered in the planning of the program, any evaluation information that might be collected already. And also it will have contact information from the jurisdiction. So part of the survey, we asked jurisdictions, if someone has questions or wants to get more information, can they contact you? And if they say yes, we'll leave their contact information here. So if you're interested in Missouri's program, and let's say Rebecca Bax with Missouri is the contact and she agreed, you'll have Rebecca's email, so you can contact her to learn more. And then lastly, we have also included some AIDS view data. So it'll say how many people living with HIV are in that jurisdiction. Additionally, underneath for show map data, if you just wanted to look at everything that was uploaded, you could just click on that, and it has it organized alphabetically by state. And so right now, we still just have our placeholders because we haven't updated our innovations yet. But once this is launched, all this information will be complete. And then you can just click hide map data. And then the site ends with the acknowledgement. So again, thanking all the jurisdictions for your hard work. We know you all have put in significant work these past 5 years. So really just want to take a moment to thank you all and celebrate you all, and appreciate the progress that you've made in your communities, as well as thanking HRSA for funding this. And then the site ends with our NASTAD EHE teams, both the NASTAD skip and also our prevention EHE teams. So again, if there's any questions, if there's any technical assistance needs, you can reach out to any of us. I know that was a bit fast, so I do want to pause for a second and see if anyone has any questions. Or I'm not looking at the chat, but Sarah, are there any questions in the chat so far?
No questions in the chat so far, but I'm keeping an eye out in case anyone would like to drop their question in the chat.
All right. So that was your exclusive sneak peek. Again, this should be released very, very soon. We've already sent the information to our comms team for them to start uploading the innovation. So I would definitely think before the end of the month, you can expect to receive a memo from us saying, you know, the announcing the official launch of this microsite. But now you'll know what it looks like, how to navigate it. But if any questions do come up, please definitely let us know. I'm going to switch screens again. Thank you all for your patience.
Hey, Allison, we do have a
Yes.
question from Ronique Pleasant.
Okay.
Team. Give me just a second. Will the submissions on the site be included continuously? Will submissions
So
be included on the site be continuous?
yeah, so the site will continue to be updated. So we are launching it with 10 jurisdictions so far, because I think we've received about 10 to 12 completed surveys from the jurisdictions with all their information for their innovative activities. But we are still doing continuous outreach to the jurisdictions who haven't completed that yet. So we will continue to update the site in the coming months. And the goal is to have every single jurisdiction featured. I hope that answered the question.
Yes, it did. Thank you, Allison.
You're welcome. Any other questions? All right, well, if anything does come up, definitely feel free to utilize the chat. But I am so excited to have Natalie and Alyssa here with Columbus Public Health, and they're going to be sharing with us their innovative activity that will be featured on our microsite. So Natalie and Alyssa, I'm going to turn it over to you.
Hi everyone, this is Natalie Brooks. I use she, her pronouns. I'm a program manager at Columbus Public Health. I oversee the programs for pillars 1 through 4 and provide supervision and support to our EHE program managers. So very excited to be here and to share more about the status neutral housing program that we fund. So I'm going to pass it to Alyssa so she can introduce herself.
Hi, everyone. My name is Alyssa Gates. I use she, her pronouns. I am the program manager for EHE under the diagnose pillar, as well as working on the status neutral program. I'm also very excited to share this. I think that it's a great program, and I'm happy to be able to share it with you all today.
So we're going to kind of go back and forth with sharing this information, but I'll go ahead and start us off. So next slide, please. So specifically the housing program that we're talking about today, it came from a series of conversations that took place regarding identifying needs for clients across our network in Columbus. And so I'm sure a lot of people are experiencing something similar where housing is a really big issue. And so we were trying to figure out ways that we could use our ending the HIV epidemic dollars to provide support in that space. So we did do some exploration around housing first. That's not something that we have done before at Columbus Public Health or funded an agency for. So we definitely wanted to explore that as an option and figure out what it is that we could potentially offer for community members. So we already had a partnership with Lutheran Social Services. They are an agency here in Columbus that offers a wide variety of services, but also has a focus in housing. So we explored all of our options, but definitely landed there because they do have experience in housing as well as vulnerable populations. Next slide. Okay, so Lutheran Social Services, we call them LSS. They are a faith-based organization that focuses on health and human services, and they provide housing, healthcare, emergency assistance, and other program services. And their main goal is to really address the whole person, not just focusing on one particular thing, but ensuring that everyone has their needs met to allow for individuals to feel empowered to make whatever health decisions they want for themselves. So they are an FQHC. Even though it is faith-based, it's not a requirement for clients to participate in any faith-related activities in order to receive services, which was a huge plus for us. So we decided to move forward and contract with them in October of 2023. And we were using ODH EHE funds to support a small pilot project specifically for individuals who are HIV negative. And so that's kind of how this program started, starting off focusing on those who were HIV negative, what it is that we could do to support their social determinants of health to keep them HIV negative. And that is how the Home Housing Outreach Motivation Engagement Program was developed. Next slide. So we started off using ODH EHE funds, but we had some other conversations with our EHE HRSA project officer, and he strongly encouraged us to make it a status neutral housing program by braiding two funding streams together in order to offer services to both individuals living with HIV and those not living with HIV. So after we had a meeting in October of 2023 to discuss the Big Bet initiatives hosted by HRSA, we decided to focus our energy there, put a lot of our extra funds into the housing program, and so additional funds were given to LSS, so the pilot program became status neutral. Next slide.
All right, so in our first year of this program, which we are also still, as Natalie just said, we're still technically in our first calendar year of this program. We really started off by developing the work plan using SMARTY goals. The goal of doing it this way was so it was collaborative. We were working together with LSS so that they had a say in how it looked. It made sense for their capacity and what was realistic. And really so that they knew and we all knew what was expected of everyone. As Natalie mentioned, Housing First was new to Columbus Public Health, but it was also new to this team at LSS. So we wanted to make sure that everyone had a good grasp on what Housing First looked like, what expectations were. So we did provide TA through another community partner. They were able to offer that to not just people directly on this program, but other individuals at Columbus Public Health, as well as obviously for LSS. It is the expectation moving forward as they hire additional staff that all of their staff does receive Housing First training. We also provide and offer other TA in related areas such as motivational interviewing, trauma-informed care, ethics and boundaries, and other trainings and TAs specific to the populations that they're serving. And again, it's the expectation that as they hire new staff that they are all receiving these trainings. Next slide. So within this, it really was the expectation that the team at LSS was working on building the relationships with the landlords in the area. As Natalie mentioned, they have other housing programs, so it was helpful to be able to utilize them and utilize landlords that they had already had some connections with, but they have been able to build new relationships with new landlords. In particular, there's several shared living opportunities that have been really beneficial and great opportunities for some of the clients who come with extensive barriers. With housing, you have, often you're having folks that have multiple evictions, recent evictions. Sometimes there's other issues around, immigration and other barriers. So they've really been able to work to find landlords in the area that can accept third-party payments and are wanting to work with their program. They are coming from a whole person. So while we are focused on the housing side, home the full program at LSS also focuses on their health wellness. So they have other aspects of the program that are addressing their other areas of need as well to make sure that the individual is receiving case management services that provides access to any resources that they may need. In the 11 months, roughly, that we've had this program going, there's been just around 11 clients who are able to receive housing services from the ODH side and roughly 28 clients from the HRSA side. And they're able to receive this on an ongoing basis. So if a, sorry, I saw a chat pop up. So for individuals that they might just need a one-time emergency, that's an option, but there are individuals that benefit from multiple months, so they're able to receive that funding as well. I think something that is really great and something that's worth noting is that a lot of the referrals are coming from word of mouth throughout the community. So while they do advertise and agencies are able to, talk with their clients about this, a lot of it is coming from within the community and being shared that way, which is a positive thing. That means that people are finding worth within this program. As a part of this program for individuals who are coming in, there is an expectation, while it's not required, but an expectation that they are getting screened and or tested. They did not find in this first year any new diagnoses for HIV, but they were able to get some folks back into care, help them to remain in care, and were able to get some folks in preventative services as well. Next slide, please. So we are now in the second fiscal, in year 2, in our next fiscal year, we were able to provide a significant increase in their contract award amounts with the intention of serving more clients throughout this year. Within that first year, with it being the first program and not quite starting at the beginning, actually serving clients in that beginning of the fiscal year, they weren't going to obviously need quite as large of an award amount. So we were able to expand that this year. As they move into this next year, they're looking to expand their staffing for a supervisor position that could be dedicated to the case management team, just to provide a little bit more focused support there. They have also been able to participate in additional testing events within our community with other community partners, and they plan to attend more to promote the home program. Next slide, please. So one of the great things that came out recently is HRSA offered new guidance regarding security deposits. So we have been working on the policy to get that approved so that we can move forward with LSS being able to pay for security deposits, as we know that that is often a barrier for clients where they can get rental assistance, but they can't get security deposit assistance, which can be a large barrier. So we're very excited about that new guidance from HRSA, and we are working forward on towards that. LSS has been creating their internal policy as well. And we were also able to create an agreement specifically between the landlord, the housing provider, and the client to ensure that there was a good understanding of how the security deposit was really going to be paid and any refund that might come back from that, how that was going to work. So that has not started yet, but once that policy is approved through all of our lanes that has to be approved by, then we will be able to implement that, which I'm very excited about. Next slide. So that's really it. That's the home program. I saw a couple chat, at least one coming up, the little balloons. So we can look through those questions. Natalie?
Yeah, so I do see a question from Jonathan Joseph. The question is, HRSA funds are limited to people with HIV. How are you able to provide service to HIV negative persons? So I did want to provide some clarity. So we do have two funding streams. The Columbus Public Health team does have two funding streams. So we have HRSA, and that's specifically for individuals living with HIV. And then we also receive funds from the CDC funneled through our state health department, ODH, Ohio Department of Health. And so we're using the ODH, Ohio Department of Health / CDC funds to provide services to individuals who are HIV negative. So that's how we're able to provide services to HIV negative persons. We're not using EHE HRSA funds to provide services on the prevention side. So they're two separate things, which can sometimes be confusing for our provider LSS, because there are two separate timelines, two separate sets of rules, all that fun stuff. But that is how we're able to make it status neutral, by braiding those funds together. Good question.
Thank you so much, Alyssa and Natalie. That is such a great program. And I can only think of one other program that does housing for people who are HIV negative. So really excited to now know there's another one. Are there any other questions? Right, well, if there's no other questions, we're gonna keep on going, so that way we have enough time in our breakout rooms. But if any questions do come up, their contact is here. I will be sharing these slides, so you'll have them, or definitely you can still put them in the chat. Right, so now it is my favorite time where we all get to learn from one another. So before we go into our breakout rooms, I would like for each group to address some of these questions. Hopefully you'll have time for all of them. If not, that's okay. But I would suggest you at least have one person in your group who's taking notes, because we will be coming back as a large group to report out and share what was discussed in our small groups. And each small group will have a NASTAD staff in the room to help facilitate this conversation. But in our small groups, we're going to first be talking about, how do we define innovation? And, you already started thinking about that with our Menti poll, right? We want to hear what innovative activities you're doing in your jurisdiction. Also, are there any innovative activities that you have heard from other jurisdictions that you would like to implement? And then what are your challenges? What challenges have you experienced in your planning and implementation process? What successes have you had? What wins have you had? My colleague will be dropping these questions in the chat if they haven't been dropped yet already. But are there any questions before we go into our breakout rooms? All right, well, if that was clear, I think, Sarah, you can go ahead and place us on our breakouts. Looks like we're all back. Yes. Okay. So I know we don't have a lot of time left, so I'm gonna ask one person from each group to share, and if we could keep it to like 90 seconds. And thank you so much, Alyssa. I'm gonna pass it to you to report out for our group.
All right. Hi, everyone. So our group, it was myself, Naima, Jonathan, and Renee, and Allison. So we were discussing the various programming that our various jurisdictions are working on. And I wish I would have taken a little bit better notes on that. I was so focused on what people were doing. But Naima mentioned, and you're in, I think, Philadelphia, if I remember correctly. Yes. They're working on focusing on their aging with HIV population, and have a kind of symposium that is coming up, which is great to hear. They focus on the aging population. Renee had mentioned kind of focus on, and you're in New York, I believe, right? Okay, trying to remember. Focusing on working with Black and Latino populations, And oh, my brain just died. Expanding services, and I might need Renee to remind me what you had mentioned. Jonathan's programming that I really found interesting, and then was taking a note about that was that there are various agencies they work with, and correct me if I have this down wrong, Jonathan. There's MOUs between the agencies, so the way that my understanding is that it works is that if one agency is lacking in a service, they are connected with another agency to fill that gap. And there seems to be a pretty good communication between these agencies. And then we discussed for Columbus, just some of our expanding services as well to exploring services with youth population and ED testing. Renee, is there, I'm so sorry, I forget the program that you were working on.
Yeah, thanks. No worries. We were talking, I mentioned our Hep C and HIV co-infection work, as well as our attempt at updating our data systems. But everyone's programs are great.
Sorry. Thank you. Sorry.
Thanks, Alyssa and Renee. That was great. Anyone from Sarah's group would like to go next?
Any brave souls, or otherwise I'll just summarize it quickly, maybe Natalie or Scott, because I think the conversation you had about braided funding was really interesting.
Sure. Hi, I can come on camera too. I'm at the office. I hope it works. I really enjoyed our conversation. Thank you for everybody who participated. We talked about got to ask more questions about Natalie's experience in Columbus, braiding funding and how they were able to do it, how they procured for EHE services in tandem with Ryan White Party programming through RFPs, and got to talk a little bit more just generally around ideas for braided funding and what that looks like and how that could look. It seems like everybody kind of had the same confusion or questions around successful ways of doing it outside of just doing a separate RFP. And so we were able to discuss that a little bit, but I don't know that there was a lot of resolution that we came to, just more questions asked, but I definitely thought it was really helpful to hear more about Columbus's experience working with their team and across units to procure EHE services, ensuring that Ryan White Party providers would be the recipient, or Ryan White providers could be the recipients of those funds.
Thanks for sharing with us, Scott. And even though it might have created more questions, that's okay. That's what the space is for. And now you have new friends in Columbus, Ohio that you can reach out to, and we can continue these conversations.
Definitely, thank you.
Would anyone from Brittany's group like to share?
So we had a great conversation. Yes, Anna's going to be our reporter for today.
Thank you, Brittany. I'm sorry. I just was looking for the mute button. I got to be in a group with Mississippi and New York City. Mississippi shared about a really great innovative program that they are doing, which is around developing an HIV and STI training for visually impaired and legally blind individuals that includes translated materials in Braille for individuals who read Braille. This is really exciting. They talked about challenges they might have, including the fact that many STIs are identified by visual symptoms, and to talk through how to address that and think through alternate strategies for talking about identifying STIs among people with visual impairment. The other group that we talked that shared about their strategy was New York City, and they talked about braiding funds, which I think we've talked about a couple of times now. So I'll let that stand. But yeah, it's nice to see some former New York City colleagues.
But we also learned about what you're doing with the Asian population. And it's funny that one of the consultants that they're using used to be a planning council member or the director of the planning council, Grant Harriman. And it's funny to see that he's working with you guys on serving as an expert on the Asian population. Yeah, but speak to that too. You're doing amazing work.
Oh, thank you. The other thing I really want to highlight, and I think is the most important thing about our aging work, is that we have a community led planning group. So we do an event called Aging and Thriving every year, and it is planned and put on by for and about older adults impacted by HIV. So we have a planning group of really incredible leaders in our community, and we pay them for their time and their expertise. And if you can find a mechanism to do it, EHE does allow the flexibility, and it's important, so do it.
Thank you so much. That's incredible. I know we are at time. So my colleague Sarah is about to drop our evaluation in the chat, and I'm just going to wrap us up really quickly. Thank you so much for spending this hour with us. I really enjoyed it. I hope you all did as well. If you have any questions for us or need any additional technical assistance, you can reach us at eheskip@nastad.org. If you could just open up our evaluation, even if you don't complete it right now, that's okay. It's very brief. It'll really help us plan for our next one. And we hope you can join us October 8th for our next in the series. We'll be talking about social determinants of health. But thank you again, everyone. Thank you for all the work you do in your communities. Good to see so many of you on camera. Makes me really excited, not to be talking to black boxes. So appreciate you all and have a great rest of your week.
Thank you.
Thank you, everyone.
Thank you, everyone.